I'm Jay Lawrence. I'm a general surgeon here in Port Townsend. This July I'll have been here for 21 years. I've been the acting chief of surgery now for the last 2 years. I came to Port Townsend right out of my residency. My preference was to practice in a small to medium-sized town with 2, 3 or more surgeons.
Hi, I'm Dr. Mitra Jafari. I'm a general surgeon here in Port Townsend, and I came here from Dallas, Texas, and the unique opportunity for general surgery brought me here to this location in the beautiful mountains and on the coast. I thought this was a great opportunity to be able to practice true general surgery with a broad range of procedures. Before coming here in a residency training, I did a pretty broad range of things, anything from trauma to laparoscopic type of procedures to endoscopy and even other subspecialty type of surgeries. Since coming to this area, my focus is more on general surgery, and I do things like upper and lower endoscopy and intestinal surgeries, whether that be resection or gallbladder surgery, hernia surgery, and breast surgery as well.
The question of patient relationships, I think, certainly more critical in a small town where we develop a relationship with a patient that develops into a relationship with a family, and then really that flows over into, I think, a relationship with the community.
So I think it's really important to most people when they're getting care, whether it's for something routine or something emergent, is that they want someone who cares about what's going on, someone who's going to take time to get to know them and their specific situation. I think people want a personable doctor, and they want someone who cares about them and who doesn't treat them like a number.
We have, I feel like, a strong primary care base. We have, I feel, dedicated services throughout the hospital and throughout Port Townsend that allow us to do, I feel, a variety of surgical procedures.
Every patient before surgery goes through different checklists, and that starts from the office visit to make sure that they have everything to help prevent complications from their surgery. So that starts even before the surgery up until after the surgery, and we are on the lookout for things like infection after surgery and for any complications that may happen. We try to have patients in their best health that we can when it's not in an emergent setting. So we also have review committees that look at our quality, and we're scrutinizing ourselves to make sure that we are providing the best care.
Certainly the majority of procedures we do are elective procedures. For a general surgeon, that ranges from the gastrointestinal endoscopy, colonoscopy, primarily for screening, but also in patients that have intestinal bleeding to identify and stop any source for intestinal bleeding. As far as the range of surgical procedures, again, it's from very minor procedures, lumps, bumps, skin lesion removal, to major abdominal surgeries and cancer surgeries. As far as complexity, some of the most complex cases are typically the emergent cases that come through the emergency rooms, patients with an acute bowel obstruction or intra-abdominal bleeding secondary to a trauma.
Well, I think patients who live locally should know that we do have quality care and providers who are going to individualize their care and to give them what they're looking for, which is a good outcome, positive results, and I think that we do provide that here without patients having to drive a long way away to get that same outcome. So I think people should consider us before thinking about going somewhere else.